To assure the efficient and effective regulation of medical marijuana while promoting public health, maintaining public safety, and keeping marijuana out of the hands of children. I think all of us here would agree that those are priorities we hope to adopt as well.
The balance, of course, needs to be between onerous restrictions that contradict the will of the voters versus not enough regulation that also contradicts the will and intent of the voters.
I would make sure that your system is very tight, that there's a closed loop system where you're tracking marijuana from seed to sale, and that you have proper state regulators who can watch over and audit those systems at pretty regular intervals to make sure that that is not getting out of hand. I would say that where the system is weak, you will see people trying to abuse that system. What I would say is, if I was Florida, is I would look to not be the loosest regional system, because organized crime will recognize the loosest regional system and go into that system. We thought we'd see more monopolies under vertical integration, but actually horizontal integration has more of a tendency on the growth side towards monopolization or towards consolidation, really. And so controlling the rollout in such a way that you don't inundate the enforcement division right at the beginning will help to maintain the integrity of the system.
We don't think that there should be smokable marijuana. There should be no edibles. There should be no candy. Medical marijuana should resemble medicine and be consumed like medicine. The billboards on I-15 in Las Vegas, in about I thought it was every 10 feet, and I'm probably exaggerating that, but it was very frequent, is that if you want medical marijuana, the advertisement was go to drreefer.com and pay $85 and you can get your medical marijuana. We suggest, to the extent that you can, prohibiting advertising, at least heavily regulate the advertising by physicians and dispensaries. No drreefer.com in Florida.
Doctor accountability. With all the thousands of doctors in Florida, you can imagine that there may be a handful that will be less than scrupulous with regard to who they provide these certifications to.
Your public education campaigns, did they help, and what were the cost of them?
Public education campaigns started off at $6 million. We've actually increased them to $8 to $9 million per year. While we have not seen positive or negative results from our Drive High Get a DUI campaign in the long term, both our responsible use campaign and our youth use campaign have shown pretty dramatic effects. I would have paid for a responsible use campaign and a youth prevention campaign before we started with regulation marijuana in order to set the right tone. We were surprised by what people didn't know.
The mechanism, the infrastructure, the support to properly register people wasn't there, and that's one of the reasons that marijuana got out of control.
The efficient and effective regulation of medical marijuana while promoting public health, maintaining public safety, and keeping marijuana out of the hands of children. I think all of us here would agree that those are priorities we hope to adopt as well.